Hi everybody, this is Dr. Messman-Moore, and in this short video I want to talk a little bit about epidemiology. Now, if you've read the assigned pages in your textbook, you're probably aware that Dr. Raskin covers epidemiology and terminology like incidence and prevalence in the text. But because some of the comments that I have here aren't covered in the text, I wanted to create a video. So in other words, there's going to be information in this video that isn't included in your textbook. Second, I want to talk about the big picture in terms of abnormal psychology and how prevalence information is important to our understanding. So, we're all probably really familiar with epidemiology. In fact, we probably know more than we did, let's say, 6 months ago before the COVID pandemic. So epidemiology is itself a field, and in this field, the focus is to understand the distribution mostly of diseases, but in our case, mental disorders like major depressive disorder or social anxiety disorder. So epidemiology is a type of research that's done in abnormal psychology to help us understand the scope and the extent to which people are affected by mental disorders. Epidemiologists also are interested in how incidence and prevalence may differ by region, by country, by ethnicity or race, or by gender or sex. So epidemiology can help us understand the big picture in terms of how common psychological disorders are. Now, Dr. Raskin in the text defined incidence and prevalence, and I'll go over this again a little bit here, but I want to expand our discussion of prevalence a little bit further than the text did. So starting with incidence, we know that incidence refers to the number of new cases of a given disorder in a given time period, usually 1 year. Incidence is only counting new cases. So in other words, if people develop a disorder and then they continue to have the disorder, they may or may not be counted. So it's a count, it's a number. In contrast, prevalence reflects a proportion of active cases in a population at any given period of time. When I say proportion, you might think about percentages. So a percentage of how many people actually have a case, how many have a disorder that we're talking about. Now, to move beyond this initial definition, I want to point out 3 additional terms that Raskin doesn't cover. One is point prevalence, there's 1-year prevalence, and there's lifetime prevalence. So what's the difference? So point prevalence is the prevalence of active cases at any one point in time. So for example, today is July 19th, 2020. So I might decide that I'm going to assess how many people on today, one day, have major depressive disorder currently on July 19th, 2020. And I might be, for example, interested in comparing the point prevalence of major depressive disorder July 19th, 2020 to the point prevalence of major depressive disorder in 2019. This would give us a sense of whether depression is increasing or decreasing in terms of number of cases. Now, 1-year prevalence, for example, would be just looking at the number of active cases across that 1-year period. So 1-year prevalence is going to be a higher proportion of people than point prevalence, because point prevalence only captures active cases at that one time point, like in a day or a week, for example. But 1-year prevalence is looking at the whole year. So for example, if someone has major depressive disorder, they might recover, right? Most people do recover within a year. And so they would still be counted even if that depression didn't persist, for example. And then you have lifetime prevalence. So with lifetime prevalence, what we're talking about is any time during one's lifespan. And so lifetime prevalence is by definition going to be a much larger proportion of people than would be 1-year prevalence or point prevalence. So most of the research that we publish or we look at in abnormal psychology is going to be interested in lifetime prevalence, which talks about like what are the odds that someone might be diagnosed with a disorder like social anxiety disorder across their lifetime. We also are very interested in 1-year prevalence because we want to know how many people in a particular year would be affected. And then if we're really interested in looking at the spread of a disease or a disorder, then the incidence would be the preferred metric. So let's take a look at some facts about prevalence, and this will provide a nice foundation for us as we move into the course this semester and talk about different disorders. Now, you may ask, why do we care about prevalence? Well, prevalence is important because it provides information. And so when clinicians, psychotherapists, or psychologists know the frequency or the prevalence of particular disorders, it aids us in our assessment of our clients' presenting problems. So the prevalence of any mental disorder is actually not that uncommon. So the lifetime prevalence of any mental disorder is about 46%, a little less than half. But we know this is probably an underestimate, and probably more than half of people have had at least one disorder in their lifetime. And the reason we know that is that this percentage here is based upon research that does not include autism spectrum disorder, schizophrenia, or eating disorders. So it's likely an underestimate. So when you think about the textbook and we're talking about what is abnormal, and we might talk about like a statistical deviance, one thing that's really clear is that mental disorders in the United States aren't abnormal in the terms of they're not rare. So about 1/2 of people will have been diagnosed in their lifetime with some disorder. Now, the other thing we know when we look about prevalence rates in the United States is we know that some disorders or groups of disorders are more common than others. So when we look at groups of disorders, we're categorizing disorders that have some commonality. So anxiety disorders, for example, are categorized together in our diagnostic system. Similarly, mood disorders like depression or bipolar disorder are categorized together. When we look at the frequency of these, we see a particular pattern that emerges. So anxiety disorders are the most common group of disorders. What are anxiety disorders? They include things like panic disorder, social anxiety disorder, agoraphobia, those things. So anxiety disorders are the most common group of disorders. About 28.8% of people have a lifetime prevalence of anxiety disorders. Now, the 1-year prevalence is a little bit lower than that. So remember, 28.8% of people will be affected by an anxiety disorder across their entire lifespan, but only about 18% will have an anxiety disorder in the past year. Now, compare that with mood disorders. So with mood disorders, we have 20.8%, a little bit less than anxiety disorders. And mood disorders will include things like major depressive disorder and bipolar disorder. Third, we have substance use disorders. So substance use disorders are coming in a distant third in terms of a group of disorders that are affecting people. A little less than 1 in 6 people will be diagnosed in their lifetime with a substance use disorder. Now, substance use disorders, again, could include a lot of different types of disorders within that category. So that's by group. But if we start looking at particular disorders or particular diagnoses, the pattern is a little bit different. So let's look at disorder-specific prevalence rates. Now here we see that major depressive disorder is the most common mental disorder diagnosed in the United States. About 16 to 17% of people will have a diagnosis of major depressive disorder across their lifetime. Now compare that with alcohol abuse, which is a close second. So alcohol abuse is about 13% in terms of lifetime prevalence in the United States. And the third and fourth disorders that are on my list here are anxiety disorders. Specific phobia and social phobia, or what we now call social anxiety disorder. About 12%, or a little over 1 in 10 people, will have a lifetime prevalence of that disorder. So let's pause and look at this for a second. So you have the most common group of disorders, anxiety disorders, but the most common disorder is major depressive disorder. So this gives us a sense of what we might be looking at in terms of the expectation for presenting problems with our clients. So this is the end of my video about epidemiology, prevalence, and incidence in abnormal psychology. Thanks for listening.